Hi, so my name is Jana. I manage our nonprofit government and education partnerships at Crisis Text Line. I'm so excited to be here with you all today and be presenting alongside the illustrious Shelby Rowe. So to give you, we'll start by going through what Crisis Text Line is, how it works, start talking about some of the data that we see at Crisis Text Line, and then we'll talk about our partnership with the Northwest Portland Area Indian Health Board. With our text native to 741-741. So that's that. So here's how Crisis Text Line works. Crisis Text Line envisions an empathetic world where nobody feels alone. We provide free 24/7 high-quality text-based mental health support and crisis intervention. And anyone in the US can text us at 741-741 or message us on Facebook Messenger. Right now, our service is only available in English, but we are planning on launching Spanish later this year. And at that time, we'll also be launching our service in WhatsApp, which we're very excited about. So when somebody texts into Crisis Text Line, they'll be receiving 3 levels of support. The first will be the crisis counselor. These are our volunteers. They're located all across the country. They go through 30 hours of training and a background check. And the training covers things like active listening, empathy, collaborative problem solving, and risk assessment, things that we know can be applied to a lot of the different crises people reach out to us about. Our crisis counselors are supervised in real time by one of our clinical staff supervisors. They can see every conversation as each message comes in, seeing how's a crisis counselor doing, giving them feedback, and providing additional support when necessary. And the third level of support that we have is our machine learning and triage algorithm. It's called Tater. What it does is it looks at the first 2 messages people send into us. So to give you a sense, they will text into us, I'm having a terrible day. They'll get an automated message back that says, thank you for reaching out. Here's a link to our terms of service. What's your crisis? Those 2 messages are then run through Tater, and it's learned the words that people use when they're at most imminent risk. So when somebody uses those words, they go right to the top of our line. So we're reaching those people the fastest, as you can see, typically in under 1 minute. So this is the person who is reaching out. They get triaged. And then they're connected with the crisis counselor. The crisis counselor will start by identifying the goal of or they'll start by building some rapport, trying to figure out kind of what's going on in the moment. And then they'll do a risk assessment. We ask every single one of our texters if they're thinking about suicide, because we know that even if somebody is just reaching out because they had a terrible day at school, that they might be. And if they are, we want to help them through that. We use a ladder risk assessment. So we ask if the person has the ideation, the plans, the means, and a 0 to 48 hour time frame. And if they do, then it goes into a little bit of a separate flow, but 99% of the time, folks are not at an imminent risk crisis. So what they'll do after that is identify the goal, what this person really needs from working with us, do some collaborative problem solving to move them towards that goal, and share a resource when necessary or when it makes sense in the conversation. And then we'll end after about 45 minutes is our average conversation length. As you can see here more about our supervisors, in those 1% of conversations where a texter is at imminent risk, meaning that they have the ideation, the plans, the means, and a 0 to 48 hour time frame for completing suicide, then we will start working with them to de-escalate. The crisis counselor will flag the conversation for their supervisor, who will come in and determine that we ask the questions the right way and start safety planning, seeing if there's somebody in their house that they can wake up to help them through this moment, seeing if they'll distance themselves from the means, or check out a resource that might keep them safe throughout the night. And that de-escalation works most of the time. In instances where we absolutely cannot keep a texter safe, we will work with emergency responders to get the person help. So as I mentioned, we have resources that we share with our texters towards the end of conversations in about a third of them. And it's a list of over 200 that we pull from. It's a database that's kept up to date by members of our quality team. They are always accepting new resources, and they are always making sure that the resources that we have in there are up to date and accessible. Everything on our list is free and national. So you can see here the 4 kinds of resources that we share. It's things like in the moment needs, like a breathing GIF to help somebody calm down, or a worksheet to help them understand or increase their body image. So we also have self-help guides like an antidepressant skills worksheet, databases like 211 and Aunt Bertha, where people can put in their zip code, their insurance, their bus line to figure out the best way to get to resources that they might need, and online groups where people can connect with others who are having similar experiences to them. So we know that privacy and trust are very important for our texters, and it's the #1 priority for us. We are free for all of our texters that are using Verizon, AT&T, Sprint, or T-Mobile, or any of their subsidiary plans. And of course, people can reach out to us on Facebook Messenger for free as well. We've also worked with those cell phone providers to ensure that our number and our conversations don't show up on people's phone bills, because we know that that might be a deterrent for somebody to reach out who maybe their parents monitor their phone bills or a spouse monitors their phone bills. And we also adhere to stringent GDPR compliance when it comes to our data privacy and security. So at the end of every single conversation, what we do is we send out 2 surveys. So the first goes to our crisis counselor. They check off any of topics that were covered, any resources that were shared, and any coping mechanisms that the person mentioned that they like in case they reach back out in the future. And then the texter receives a link to fill out a survey where they can tell us how they think we did, how they feel now that the conversation is over, and any demographic information they're willing to share with us. And those 2 surveys, combined with the time of day, the person's area code, and things like that, come together to make up our data set that we use to track real-time mental health trends across the country. So that's what I'll be talking about in this section about our data. As you can see, we've done, I think it's actually 6 million conversations now since I made this presentation a few weeks ago, since we started in 2013. That's with 2.8 million texters. So as you can see, that means that about half of our texters text in twice. And that could be that they texted us once in 2014 and then once yesterday. That's all totally okay with us. We've done 79.8 thousand suicidal de-escalations. That's when the person is at imminent risk and we're able to de-escalate them without needing to involve public safety. And almost over half of our texters share something new with us. We think that crisis text line can be a stepping stone to getting additional mental health care. And so that's why we track that metric. And then 87% of our texters said that they found the conversation helpful. So one of the things that we can do is we can track what's going on in different communities and with different issues across time. We put out each year a report that looks at our data from the previous year to identify specific trends that are going on. So what I'm presenting on today is a report that we released at the end of April with 2020 data called Everybody Hurts. There's a link down here in the bottom. And as you can see here, we have this pink bar is 2019 and the red bar is 2020. These are issues that came up in our conversations in that time frame that our crisis counselors checked off based on what was covered in the conversation. And we can see here that issues like anxiety and stress, issues like grief were much higher in 2020, where issues like depression and sadness and suicide came up less often in 2020 than it did compared to 2019. And this link has much more great information about the topics that we see. We also use area code to track where people are texting into us from. It's all on a high level anonymized and aggregated basis. So we don't know specifics, but we can guess where people are reaching out to us based on our area code. So this map represents the percentage of conversations about anxiety and stress that texters from each state as categorized by the crisis counselors in 2020. So this darker red color is where we had close to between 37 and 40% of texters mentioning anxiety and stress. And this light pink color is where we had 32.9% or less. So this helps us understand which states are maybe dealing with the most anxiety. given the year that 2020 was, that makes sense that New York would be very high for this, since that was kind of where the pandemic all started, as well as California. And of course, that also could be with those being very populous states. So from the post-conversation survey that our texters fill out, which about 21% of them do, we know what our texters look like. So as you can see, the majority of our texters identify as female, with a percentage identifying as male as well. And we ask folks if they identify as trans, agender, or genderqueer. The majority of our texters identify as straight, but an overwhelming percentage also identify as LGBTQ. I think that we over-index in that section. The majority of our texters identify as white, with about 20% identifying as Hispanic. And the majority of our texters, as you can imagine, being a text-based service, are between 14 and 17 and under 25. But we, of course, have texters who identify as younger than 13 and older than 65. So we really help everyone who comes to us. So this is kind of how we use our data. Because it's coming in real time, we are looking at a data set that has incredible volume, velocity, and variety. They tell us who's texting in, what they're texting about, when they need help. And we publish this data in a number of ways so that we can hopefully inform public policy and public health efforts, so that they can be targeted to the specific needs of communities. So I went ahead and pulled in some of our data around texters who are identifying as American Indian or Alaska Native. That's about 4% of our texters overall. Of these texters who identify this way, we let them check off as many identities as they apply to themselves. So you can see that about half of our American Indian and Alaska Native texters also identify as white. About 21% also identify as Hispanic, Latina, or of Spanish origin, and about 20% also identify as Black. Conversations with these texters often over-index for issues related to suicide and self-harm, and they are under-indexing for topics around COVID-19 and third party. And that's just representative of what people are texting into us about, not necessarily representative of the issue at large. And third party here, this means that somebody is texting into us concerned about somebody else, so not necessarily texting in concerned about themselves. And an interesting data point that I noticed in this research was that our American Indian and Alaska Native texters over-index for identifying as asexual, genderqueer, or trans. So this is kind of just a slide about our methodology. Like I mentioned, it's representative of the 21% of our texters who are filling out the post-conversation survey and the 95% of our crisis counselors who are filling out their post-conversation survey as well. So I'm going to turn it over to Shelby to talk a little bit about how we are working with Thrive at the Northwest Portland Area Indian Health Board.
All right, and while we're still on this slide, I want to introduce myself a little bit. The team from Thrive at the North Portland Area Indian Health Board, they were all busy this week because they are hosting an annual youth leadership conference. And so I volunteered to help out and to speak with them. I serve on the Crisis Text Line's Clinical Advisory Board, and I also am one of the co-founders and co-chairs of the Indigenous Peoples Committee for the American Association of Suicidology. And I have been part of conversations all along as a Chickasaw woman of wanting to know, what services, how is Crisis Text Line working with our Native youth, and what can we do better? What can we do different? And so I've been part of the conversations for this partnership all along. So I'm happy to be here filling in for their team. But any questions specific to that, we can make sure at the end that you guys know how to get a hold of Colby Coughlin, who is with their team. Okay, on to the next slide. So just as a refresher, the North Portland Area Indian Health Board, they work with several different tribes. It is their mission to assist Northwest tribes to improve the health status and quality of life of members of tribes and Indian people in their delivery of culturally appropriate and holistic health care. They have a lot of different innovative programs, but as I'm sure many of you also work for different Indian health boards, you kind of already are familiar with the mission and everything, but this is their service area of who they work with. Next slide. And then, oh, okay, on this, I was like, wait a minute. Slide. So with this partnership, it was kind of twofold. One, they were interested in making sure that they could get good data because, which could be a whole presentation in and of itself, is it's difficult to get good data on our Native youth. Oftentimes the data sets are small and it's hard to get access to them. And so we wanted a way that we could know who was accessing this. And then we had conversations also with IHS and others, because we wanted to know how we could build a database to know kind of what those needs were for our young people and to get that good data that often doesn't exist in our CDC death data sets. And of course, finding our data on our young people 2 years after they died that's not good enough. That's not enough for us to know what's happening, how we can be responsive as public health professionals to their needs, how we can work with our communities. And Crisis Text Line is really doing a great job of helping people in crisis. And so we wanted to make sure. And so on the back end, so that we've had lots of conversations working, actively working with Jana and the entire team at Crisis Text Line on how do we provide more training. As you know, for some Native communities, 911 is not an option. It's, call your local travel police, or where is help and what does that look like? And so we've been working with their team on the back end that for that small 1%, I believe, of the calls or less than one. Good, Jane, I was like, I thought it was 1% that do need emergency intervention. We especially want to make sure that our Native youth who need emergency intervention, that person on the text line they're talking to knows how to get them connected with the appropriate and relevant healthcare that's accessible to them. And so providing some information on the back end for them, and then also doing a better job of reaching out in our tribal communities to make sure that individuals know that Crisis Text Line exists. And so the two key words that are part of the partnership with the North Portland Area Indian Health Board, which we hope, I will make a shameless plug, hoping that if your organization also wants partnerships with Crisis Text Line, that you would use these same keywords so that we can really get some good national branding for this. And their team is so good at parsing out the data, which we can get into a little later, to get you data just for your region. But we would love if we all have the same keywords, or if not, if we can all work with Crisis Text Line to have agreements that we can share data. But we wanted the co-branded text lines. We wanted something that we could do the branding to make it more relevant, more specific for our Native youth, so that they know they have help available 24/7 on their phone. When young people text this, it goes straight to Crisis Text Line. Their crisis counselors are very well trained. They get ongoing technical assistance. I can't brag enough about just the passion that goes behind how well they work with the people that reach out for service. So it really is a high quality service. They're very good at de-escalating. And oftentimes when we're in crisis, we lose our voice. And so I think having a crisis text line is so helpful, because even when you can't find the words to speak, to talk about what's happening, oftentimes that you can text it. And, for many of our families, if you're living in a busy household and there's a lot of people, you just don't have the privacy to do a phone call. But you can still text and get help. So if there's anything else on this slide to cover before we go to the next, and I will continue giving a shameless plug for this partnership. So the first marketing materials that they've released are fairly simple. And I know there's going to be some more coming up sooner that have a little more imagery that's really going to relate well with our Native youth. But these are the first things that they've released through Thrive. And there are postcards, there are bookmarks, there are wallet cards. So really anything on that you might want, you can message. Oh, good. Lael and Colby's emails are on the bottom of this. Either one of them would be happy to mail you either the hard copy materials, or they can send you the PDFs if you would like to do printing yourself, or they're happy to work with anyone in Indian country to make sure that everyone has access to this, that it can be distributed to our young people. Great. Yeah, because we want to make it easy for everyone to this. But yeah, so and then with those key words, Jana, can you talk a little bit about how when people enter in, because they may see other materials that say, text hello. I know the Muskogee Creek Nation here in Oklahoma, they have their own keyword of text Creek. Can you talk a little bit about how the keywords work?
Yeah, sure. So one thing you all should know is that no matter what somebody texts into us, they are going to receive help. So they could leave their phone unlocked in their pocket and send us a letter soup, and we'll still ask them if they need help. So no matter what, people will receive help. What these keywords do is they help us in two ways. The first is that they allow our crisis counselors to have a little bit more information about where this person came to us from. So it may not be extremely helpful for partnerships like ours with the National Alliance on Mental Illness. That's pretty broad, but it's very helpful for things like our partnership here, because when somebody texts Native to 741-741, the crisis counselor will see that, and it'll include a message that says, hey, these people came to us from the North Portland Area Indian Health Board. You should probably look at the tip sheet that we created in partnership with them and IHS and with Shelby for information about how to best help this texter. It includes specific resources like Strong Hearts. It includes pointers on colonization and how that still comes into play. Boarding schools, which with the heartbreaking news that we continue to see coming out of Canada. So that's what's really helpful here about the Native keyword and the keywords there. The second piece is that it helps us aggregate data on the back end. So we're sharing back with Colby and her team a dashboard that breaks down how people are reaching out using the Native keyword, how often they're reaching out on an anonymized and aggregated basis, the specific topics, the specific age ranges, so that they can take a look at that. Oh, and the specific area codes, so that we can see where in Indian country people are reaching out to us from. And that can be helpful in understanding where more programming might be needed, what kinds of programming might be needed, and how to rally communities around that. So that's really how keywords work, and how they're coming into play in this partnership.
Thanks. And with these customized reports, that it makes it easier for grant writers, if you're doing something, to really tell the story of what's happening in your area. And so with having that data, that would be something available. You could reach out to the North Portland Area Indian Health Board. And I know as more data starts to come in, this partnership's new, so our pool of data is pretty small at this point, admittedly. Hopefully it'll get bigger after this presentation. But to parse it out, because to help us tell that national story and to advocate for our young people and for our adults, but it also helps at the community level. So if you are writing a grant in the upcoming months and years, reach out to the folks at North Portland Area Indian Health Board and say, hey, here are the area codes in my area. Here is the stuff. What do you have, for my area that I can add as data for my grant? Because oftentimes when we're looking and doing those needs assessments and what do we need and collecting that, it may be hard to find Native specific data. And I really appreciate that Jana brought up, the tip sheet and fact sheet. We surveyed individuals. We talked and had some focus groups with other folks in leadership and suicide prevention across the country, working specifically in tribal communities. And we're like, what do we need? We convened I guess it's the American Indian Alaska Native Work Group for the Action Alliance for Suicide Prevention. And we asked everyone, what are things that you feel that people need to know? And so we put together a fact sheet. And if they do text Native or Indigenous, it flags that sheet so that whoever is that crisis counselor is going to get that information, that refresher sheet, right at the first. Of course, they're going to get help no matter what they text. They're always going to get help. But if you add that keyword, they're going to get that up front. And so that crisis counselor will get a little more of the basis. I think we put things in there, not only about, the long-term impacts of boarding schools and colonization, but also things like extended family lingo and things that when we talk about our auntie, our grandma, our cousins, that it may or may not have anything to do with blood relation, and different things like that, and different things that are familiar that young people are going to talk about to try to help. Some information about Two-Spirit. I'm very happy to see it looks like a lot of our Two-Spirit youth are reaching out and getting help and getting assistance. That I think one person had asked, and I saw early on, I bet we've got some other questions, but one had asked if you as a therapist could log on. And I would say yes. I'm a mother of 3 sons, and I've had, I think, all of my boys at some point. I said, hey, we'll sit together in a coffee shop. And I'm like, I want you to know that the service exists. Let's reach out to Crisis Text Line. And we will text, and then I'll have them save the number on their phone, because I want them to know that it's available if they ever need it. And so we will text in the people that are really nice. As she said, there's a quick little triage, and then someone is there very shortly, a live person, to text back. And so we just, with my sons, I didn't want to take up too much of the time of just like, hey, like say hello, say what's going on. And they were really polite, provided good information. And so, yes, I would highly recommend for a therapist to do that, because it's one thing to hand someone a card and say, you can text for help. And that can seem so intimidating and so daunting. But if you're like, hey, let's do this together. And then, all right, go ahead and save that number in your phone in case you ever want to reach out and talk to them again. It really helps to encourage help-seeking behavior to do that. So yes, I would encourage you to do that with the youth, with parents, just so people are familiar with that service.
Yeah.
So what other questions do we have? I know we wanted to make sure we had time to answer questions and then kind of see what that familiarity is with Crisis Text Line, and to make sure that you guys know it's available. And you can also, I said, if your organization thinks this is great, we want to set up our own dashboard, we want all of that, you can reach out to Jana and she can help you with that.
Yeah, and the other thing I wanted to point out about the texting in experience is that on our website, there's also a page that kind of explains what it's like to text, and it has like some GIFs that show kind of what the flow of a conversation is like. So if maybe you don't have time to do the whole conversation with them, because that can be quite lengthy just between the time it takes to text back and forth, that's a great place to send people as a resource as well. The other thing before we turn it over to questions is that we are actually looking for more crisis counselors. So if there's anybody in your community that you think would be fantastic at this, our crisis counselors are just awesome people, and they learn some amazing communication skills. I went through training when I started at Crisis Text Line about 2 years ago, and it's so helpful in even just like talking to my mom or talking to my best friend who's going through something. So in addition to it being a great volunteer experience, it is also a way to build up the empathy skills in your community. So if you have anybody that you know of, or if you work with a group of youth that, it's 18 and older. So college students is what we're always looking for. Folks who are empty nesters are fantastic at being crisis counselors as well. So there's some information about that on our website.
Yes, and someone just asked, is this service available for non-natives too? And I would say yes, a resounding yes. For non-natives, I would say that you can probably just text hello or help to 741-741. And then it won't throw them immediately into the native database, although they're happy to use, we're all the data we can get, that's great. But yeah, to do that, and yes, that I know that as with a lot of other crisis services, I'm really happy to see putting a stronger effort on being culturally sensitive to the needs of other populations. And so as someone who's worked in suicide prevention for over a decade, and as a Native woman, I am encouraged to see the efforts at Crisis Text Line, and also the National Suicide Prevention Lifeline, of recognizing the need to get a little more cultural specific training. Because oftentimes when we grieve and when we're in crisis, one size fits all is not always the best approach. And so there's a lot of exciting stuff happening behind the scenes to make sure that the care that people receive are, the empathy is there, and that it's something that's culturally responsive and relevant. Yes, and so that's always a work in progress. I know we're always, working on, hey, we can train on this, we can train on that, and to help. And so it's a constant learning process. And so on that also, I would say if you use this service and are not happy or something doesn't go well, please also reach out, because that's just another training opportunity. So definitely welcome all feedback, good and bad, because that helps make things stronger and better for the next person who texts in. And let me look at, see what other questions. It looks like a lot of people are asking about the pocket cards and things like that. On the screen right now, you'll see an email for Lael Tate and Colby Coughlin. They would be the best people to reach out to get some print materials. And they would be happy to send those out to you.
And on the Crisis Text Line website, the blog link will take you there too. There are also resources that have just the generic text hello if you are working with non-native youth.
And one thing that I wanted to highlight, and I'm not sure the geographic area of all of you, but so that we wanted to be sensitive and make sure that that on the dashboard for North Portland area, no data will ever be released that's more granular than statewide, because we know, especially in a lot of rural areas, we don't want, if there were two people, from the same county as the Rosebud Sioux Reservation, we want to protect their privacy, and so it will not be released. It'll be released as individuals from South Dakota, but for suicide prevention professionals working in that area, definitely that data will be available, but we're not, just as a rule, not going to be publicizing that any more granular than state, but that data will be available and can be shared for those from that tribe, from that area, but it will not be made public because we're being very protective, maybe overprotective auntie, but knowing, you know, that data sovereignty and just really being in charge of who's telling our stories, and especially who's telling our stories around crisis. And we were happy that the crisis text line team, because they have the ability to get super granular with the data, but we wanted it to stay more vague on geographic location just to protect tribal communities, so that they can control who's got access to their data. I don't know if that's a concern for anyone on this call, but it was for us. And so we wanted to make sure that that was part of the plan and partnership.
I've seen that a couple of people have joined pretty recently. So please let us know if you have any questions around how the service works, around our specific partnership. I know that we got through our information pretty quickly, but like Shelby said, we wanted to leave plenty of time for questions because we know that if you have questions, and I'm sure that the youth that you work with have questions, and we'd like to give you all as much information as we can so that you all feel comfortable using our resource when needed and sharing our resource with folks who might need it.
Yeah, I'm scrolling up and trying to, I don't know if you saw any other questions that we've missed.
No, I just think a lot of people were really interested in getting the little pocket cards, and I typed in the email addresses in the chat box as well, if that's a little bit easier for people to copy and paste. But feel free to ask more questions or unmute yourself for a question or comment, concern. Okay, someone asked if you can share more about how to become a crisis counselor.
Sure. So you can go on our website and apply. That process is you have to submit 2 references. You have to be over 18 and you have to have some sort of government identification number, usually like a social security number. And then you'll be directed to go through a short exercise that gives you an example of what it's like to take conversations on our platform, because that can be triggering for some folks. And so we want people to know upfront what they might be getting themselves into. Then from there, you will be, applications will be reviewed, and then folks who are accepted will go through our training. The training is 30 hours. It's done entirely at the person's own pace. After somebody's accepted, they get connected with one of our coaches. These are our volunteer support staff who work just regular business hours, and they will provide some guidelines for how to go through training. It's done online. And there's a couple of exercises that are hand graded. So those are kind of the only speed bumps, but other than that, they just provide sort of a guideline and here's which module you should finish by when. And then from there, the training is done at the person's own pace. And some things that are hand graded are risk assessment. That is such a critical piece of our work. And so we want to make sure that that is done with the utmost care. And then there's like a final assessment where you're doing a pseudo conversation, and that's hand graded as well. Then from there, the crisis counselor can start taking conversations on our platform. When they first log in, they'll have a little baby chick next to their name on their screen so that everybody knows that they're new. Their supervisor knows that they're new. And after time and after doing more conversations, that goes away. So that's a little bit about what it's like to become a crisis counselor. And thanks, Shelby, for putting that in here.
Welcome. And then, so Scott, and I have a question. So I'm going to assume that you meant a crisis response team, if that's from local mental health providers, or if that is your individual tribe that's providing that. But I would say overall, the training that's provided is definitely appropriate for the communities who have crisis response teams. If you have a heart to help people in crisis, I think that doing the training is valuable. And I think that the crisis line, the texting counselors, I was like, when is it? They're not texters. Yeah, the crisis counselors on text line that are really, really good at de-escalation. And so when they do have the need, that they are able to help de-escalate and help that person stay safe at home without having to engage formal resources. But for that 1% who do need more intensive, that may need a face-to-face mobile response, that may need inpatient, that if your local 911 provider knows how to access and dispatch your crisis response team, then that will be good. If they do not, let us know, or Jana knows, so that we would know on a regional basis of how to, because yeah, they would need to know how to access that if there's a different way to access that crisis response team besides the local 911 dispatch.
Yeah, Scott, to give you a sense of where we get those emergency numbers from, we work with the National Emergency Number Association. It's a lot of public safety access point numbers, but one of the things that we're working on with Shelby and the rest of the team is figuring out how we can capture resources that might be outside of those emergency numbers. But at this point in time, when we would contact somebody in your area, we would rely on that 911 operator to know the best thing to dispatch.
And then it's the crisis line for other crises besides suicidal. And I would say, Rena, a resounding yes. In fact, you know, I've heard a talk by the founder of Crisis Text Line on assisting someone who was a victim of sex trafficking. Helping to get them out of that. So really, anytime that anyone is in crisis, there we go. Jana brought up our visual. The most of the calls are not related. If they just need to text with someone, you know, if you're like, hey, I'm at school and this is happening and I'm freaking out in the bathroom, having a panic attack, that crisis text counselor can help just walk them through and sit with them so they don't have to be alone for that. They're definitely equipped to handle a suicidal crisis, but ideally, everyone will reach out before it becomes a life-threatening event to get help before it's that intense of a crisis. But they can help at any level. If you're having a panic attack, if you're nervous, if your parents are fighting in the other room and that's making you feel weird and you just need someone to talk to, they can help with that.
Yeah, and I also want to point out, because it's something that I know was important for me when I was in times of crisis before my therapy days, which is that just because somebody's texting into us about suicide doesn't mean that we think they're imminent risk. So we use a ladder of risk assessment where we ask if the person has the ideation, the plans, the means, and a 0 to 48 hour time frame. So if they say, yes, they have the ideation, yes, they have the plans, yes, they have the means, but you know, maybe it's something they are thinking about in the next month. What we're going to do is we're going to try to de-escalate them. We're going to try to provide them with resources, and they're not going to go into any sort of specific flow. It's really when somebody has all 4 of those criteria that we consider them imminent risk and take a more like high touch with a conversation. But you know, maybe somebody is just experiencing something and yeah, they've thought about suicide, but it's not something they're thinking about today. Fantastic. And just because you mentioned suicide doesn't mean that, you know, there's going to be somebody showing up at your door. That's not what we want. I know that's what I needed to hear when I was in crisis.
Yeah, and that's a good point. I'm glad that you brought that up because for some individuals, suicide ideation is something that they live with on a day-to-day basis and may or may not be in need of emergency services. And sometimes those emergency services can be traumatizing in and of themselves. And so, yes, a lot of training has gone in to that science, and a lot of research of making sure of using the best practices for crisis de-escalation, and then how to assess risk level for those calls that are related to suicide or other dangerous, harming instances. But yeah, being very, very judicious and cautious of when do you involve outside law enforcement.
So I see here a question around our resources and our referrals. So our database is all resources that are national and free. In an instance where somebody is texting us, an example that I frequently use is if somebody is really upset that they don't know how they're going to put food on the table for their family tomorrow. What we'll do is we'll help them through the emotions around that particular crisis, and then maybe share with them a database like Feeding America's Food Bank Finder, where they can put in their zip code and find something nearby them. So we don't refer directly to any local agencies, but we help texters use databases like that to find the resources that they need in their area.
There was a question in the chat a little bit before that one, and someone asked if you could explain on the locally branded text lines.
Sure. So those are the keywords that we kind of mentioned. They, like I said, no matter what somebody texts into us, they will be connected with a crisis counselor who will ask them how they're doing and provide them with help should they need it. These text lines, what they do, like the one that we have set up with North Portland Area Indian Health Board, is they help the crisis counselor in two ways, or they help in general in two ways. So one is letting the crisis counselor know how the person came to us. Specifically when somebody texts in Native or Indigenous to 741-741, it will prompt the crisis counselor to pull up the tip sheet that we created together in partnership, so that they have a refresher on how to best help this texter. And we also have partnerships with places like the state of Ohio, where it doesn't really change much on the conversation. We just know that they found us through Ohio's programming. But all of our keywords on the back end help us aggregate data around specific communities so that we can understand their needs. And like Shelby mentioned, can be very helpful for things like grant funding, assessing the effectiveness of your messaging, things like that.
Yeah, and we're really hoping that to develop over the next year or so. I really envision us having like a data work group of all of us working in Indian country who are utilizing either the text native, text indigenous, or text whatever, your tribe name or something, that we can have a native data sharing coalition, collaborative, cooperative, where we can come together and talk about what we're seeing in our communities through the data and what we can do differently. So I really hope that some others of you are seeing this and going, ooh, we would love to bring this to our community, because it's a good service. It is free for anyone to use the service. And with North Portland Area Indian Health Board, so my one plug is if you use text native or text indigenous, it will cost you nothing. But if you would like other things, they are more than happy. I used to be state director for suicide prevention in Oklahoma. They're very reasonable on their prices, and they can help build a custom dashboard for you for anything that you would need. So if you have other data needs, please feel free to reach out to Jana. They have really good data and different data sharing agreements, and she can walk you through all of that, because I know different programs, everyone has various levels of funding. It's like you can have access to everything on this with not spending any money at all. But if you are looking for something to invest in, there are ways that a crisis text line, they can work with you to help with that. And then we would just probably on a call, you'll probably see my face or Colby's. Not that you need our permission, but we're really interested and we really want to build that data sharing collaborative and have it be an entire Indian country partnership with Crisis Text Line.
And that answers one of the questions that I think we moved around in the chat was who to reach out about regional data to. You should reach out to myself and to Colby. I can pull all of the data that we have in crisis text line in general, but for any of these sort of efforts, Colby would be the best person to loop in on that as well.
And do you want to, Jana, address what happens if a child is reporting abuse?
Yes, so our crisis council, well, our supervisors are mandated reporters. So if what they'll do is if we notice in a conversation that there might be some child abuse happening or any sort of dependent abuse, we'll start asking some questions around that. We can file mandatory reports, but we need more information from the texter in order to do that. So if the texter wants to provide us with that information, then we will. And if they don't, then we aren't able to file a report. We need things like their name, their address, and stuff like that. Anything else? I know we have about 10 minutes left.
Well, then I am going to give a shameless plug, as I'm here being substitute. I also am program manager for the Suicide Prevention Resource Center, and we are expanding our services in Indian Country, providing more suicide-specific training and technical assistance. So if you would like to be added to our mailing list, to get invited to trainings and things like that, you can email me for that, and my email is right there on the screen. Let us know, and then we would be happy with SPRC. And I believe the next session, my colleague Robin is going to be talking a little more about Suicide Prevention Resource Center, and our good friend Sade is going to be talking about the Zero Suicide in Indian Country Toolkit, which is an amazing resource that you all need to know about. So if you haven't already picked what you're going to next, I recommend going to that session, or you can send me an email and I'll make sure you get added to our email list so that you can know what training and technical assistance is coming up in Indian Country.
Sorry, I was answering the question about substance
Yes.
abuse. Going back to the emails. I'll put mine in here too.
Do you have any other questions at the moment for our two presenters?
Well, all right, we may be able to give you back like 5 minutes of your day.
Well, like many people said in the chat box, thank you guys so much for such a wonderful presentation. This is such an important program, such an important number to get out to folks. So I really appreciate you guys doing this presentation. And I just want to remind everyone to sign out if you are trying to get your CEUs. I posted in the chat the link. If you do not sign out to each session, you will not receive your CEUs. So please do that. It's very important. Also fill out the evaluation form if you can. That would be great. And thank you guys so much for a wonderful presentation.
Thank you. Thank you for having us.
Have a great day, guys.